Hey, I'm Dr. LaHood with Advanced Chiropractic and Wellness Center. We see a lot of patients with real severe disc injuries at our clinic. If you have an MRI that says you have a disc herniation or a disc bulge or a degenerative disc, let me just explain what's going on. You have two parts to the disc. You have the annulus fibrosus, which is a strong ligament on the outside, and you have that jelly-like material in the center, which is the nucleus. This is all the water, the hydration is in the center of the disc. If the joint is locked, if the joint is misaligned, if the joint is twisted and stuck, all the acidity builds up in the center of the disc. And then you start to get these fissures, which are called annular fissures or cracks and tears. Once the disc is fissured, the nucleus will push against that weak spot and cause a bulge. If it pushes harder, it's going to become a herniation or a protrusion. Okay, that hits the nerve and causes the patient massive back pain or sciatic pain down the leg. If you're suffering with any back pain, if you have an MRI that says you have a disc fissure, an annular fissure, a disc bulge, a degenerative disc, give our office a call. We have effective conservative treatments that may help you avoid back surgery. Give us a call.